Welcome to the Grant Proposal, Efficiency of Alcohol Withdrawal Scoring Tools, a retrospective review of CWA and MINDS in the ICU setting. Presented by Nancy DeCillier, BSN, RN, ICU nurse at Vail Health Hospital. Alcohol withdrawal syndrome is a severe complication of chronic alcohol abuse that can lead to seizures, delirium tremens, and even death. When reducing or stopping alcohol intake, approximately 50% of chronic alcohol users will experience alcohol withdrawal syndrome. Severe alcohol withdrawal syndrome can lead to many poor outcomes, including the need for mechanical ventilation, the development of pneumonia, and excessive administration of benzodiazepines. These outcomes can be related to insufficient assessment of symptoms, which leads to over or under medicating the patient. In 2020, the intensive care unit at Vail Health Hospital transitioned from a symptom-triggered alcohol withdrawal syndrome treatment protocol using the Clinical Institute Withdrawal Assessment for Alcohol to the modified Minnesota Detoxification Scale. This study aims to determine whether MINDS or CWA more efficiently assesses alcohol withdrawal syndrome symptoms for a symptom-triggered treatment protocol in the ICU setting. By analyzing measurable patient outcomes, the researcher will better understand the efficiency of each scoring system. The outcomes to be measured in this study include the presence of seizure activity, total benzodiazepine dosage per patient, development of pneumonia, and use of mechanical ventilation and length of stay. The literature recommends symptom-triggered treatment protocols for alcohol withdrawal syndrome, but there is no universally recommended assessment tool for such treatments. Although CWA is the most used withdrawal syndrome assessment tool, studies have shown that CWA may not be the most efficient tool for severe alcohol withdrawal syndrome seen in the ICU. By testing and analyzing alcohol withdrawal syndrome assessment tools, researchers will discover how to achieve better patient outcomes and improved community health. The general methodology chosen for this project is outcomes research. For the proposed quantitative retrospective review, sampling refers to relevant data from past admissions to the Vail Health ICU. The sampling method chosen for this review is convenience sampling, where ICU admissions for alcohol withdrawal syndrome will be assessed to determine that they meet defined inclusion criteria. Inclusion criteria for admissions analyzed are as follows. 1. Alcohol withdrawal syndrome treated using a symptom-triggered protocol. 2. Use of the MINDS or CWA scoring system for a symptom-triggered protocol. 3. Alcohol withdrawal syndrome treatment received in the intensive care unit. Alcohol withdrawal syndrome admissions not eligible for the review are as follows. Alcohol withdrawal syndrome treated outside of the ICU. And 2. Alcohol withdrawal syndrome treatment not using MINDS or CWA scoring systems. The minimum sample size for this retrospective review is 120 subjects. As this study will evaluate pre- and post-implementation of the MINDS scoring system, the data will be retrieved from 2 years prior and 2 years post-implementation. The Vail Health Quality Team will perform data retrieval from medical records. Patient identifiers will be removed from the data before submitting to the ICU Unit Practice Council for analysis. Patient outcome data extracted from the existing medical records will include seizure, pneumonia, benzodiazepines, mechanical ventilation, and length of stay. Demographic data will also be analyzed for extraneous variables that may affect results. These data include gender, race, primary language, age, weight, height, time of last drink, blood alcohol level at admission, alcohol preference and intake, previous alcohol withdrawal syndrome, and previous seizures from alcohol withdrawal syndrome. Tools to measure statistical significance will include formulas such as the t-test and Fisher's exact test. The t-test is a tool used to compare two sets of data. For this reason, the t-test is a popular measurement of continuous variables in similar research. Continuous data, including benzodiazepine dosage and length of stay, will be analyzed using the t-test. Fisher's exact test, also used in similar research, recognizes correlations in categorical data for small populations. Categorical data such as seizures, pneumonia, and mechanical ventilation will be analyzed using Fisher's exact test. This study is significant to the field of nursing as its focus is on the scoring tools used for a nurse-driven protocol. Nurses use these tools to score the level of alcohol withdrawal the patient is experiencing and then administer benzodiazepine to the patient according to the protocol. As CWA requires a patient interview to fully assess withdrawal, it is limited when assessing patients who cannot focus or coherently answer questions. However, MINDS uses clinical assessment that allows the nurse to score patients who are unable to communicate due to severe withdrawal. Innovation. For better outcomes in alcohol withdrawal syndrome, innovation is key. CWA may be the most well-known and widely used alcohol withdrawal assessment tool, but is it the most effective? The MINDS assessment tool could be the answer to innovation in treating alcohol withdrawal syndrome, but the only way to know for sure is through implementation and analysis of outcomes. By choosing this evidence-based project as the grant recipient, you are choosing to help those suffering from a growing disease in our population. From 2014 to 2018, the number of emergency department visits for alcohol intoxication at Vail Health Hospital increased by 381%. And I imagine that with the behavioral health struggles seen in the COVID-19 pandemic, these numbers have continued to rise. But with better outcomes and shorter lengths of hospital stay, we can help these patients get back on their feet and on the road to recovery. I hope you will join us on this journey to recovery by funding Efficiency of Alcohol Withdrawal Scoring Tools, a retrospective review of CWA and MINDS in the ICU setting. Thank you for your time and your consideration.